We know that rapid testing, even right now, with the variants spreading, is really important to get us to a place where we're starting mass vaccinations with lower and lower case counts. So as we've sent close to 20 million rapid tests across the country, we're really hoping and excited about the different ways and innovative, creative approaches to using them.
For the second time this week, the Prime Minister is urging provinces to make use of the millions of rapid tests they've received. These tests have been hailed as a game changer in the battle against the pandemic. Months ago, provinces urged the feds to procure more of them and do so faster. The Prime Minister said this week more than 19 million have been sent to provinces, so we wanted to find out exactly how many have been used. Here are the latest numbers provided to us by provincial governments. They show almost every province has used only a fraction of the millions of rapid tests sent to them from the feds, ranging from less than 1% in Alberta and Quebec to about 25% in PEI. Saskatchewan was not able to send us their numbers by our deadline. Let's get some reaction to that from Dr. David Naylor. He's the co-chair of the COVID-19 Immunity Task Force, and Dr. Irfan Dalla is the vice president of the Physician Quality and director of the Care Experience Institute. Dr. Dalla also served as the co-chair of the federal government's COVID-19 testing and screening expert advisory panel. Both are with us from Toronto. Hello, doctors. Good to see you. Thank you very much for making the time.
Good evening, Bashi.
Thank you for having us.
I wanted to pursue this story, Dr. Naylor, because I have heard now that, I remember covering it when the provinces were upset that they weren't being procured fast enough. Now they're being sent, and I wanted to know exactly how many are being used. I wanted to talk to you specifically because I remember months and months ago you had said these rapid tests are important. We need to get on them. What is your reaction to the low percentage of them which are being used?
I'd have to say it's pretty disappointing, Vashi. The case for these tests is strong, I believe. We have a lot of international validation of the tests. The latest I have in front of me from Johns Hopkins, again, confirms the tests are useful. In fact, it says they may be better at correlating with viral load and infectivity even than the gold standard. So I think the case here is good for these as a screening test. And so I think we have to hope that these catch on now, and in this important phase, they find wide use.
Dr. Dalla, tell us a bit about why, from your perspective, these tests can be of significance. Like, what can they help us do?
That's a great question. So first of all, they are much faster than the lab-based PCR tests, returning results in as little as 15 minutes. And while, I think David is correct that they are as good, maybe even better for determining infectivity than the conventional lab-based PCR tests, even if there's some debate about that point, they're certainly better than no test at all. And, with the conventional lab-based PCR tests, we are currently doing in Canada somewhere between 100 and 150,000 of those tests a day. And, when we talk about getting people back to work, getting people into schools, the more we can use these tests, the more we can get people into those kinds of environments safely, so long as these rapid antigen tests are not used as a free pass. It's really important for people to understand that they still need to follow public health guidance when it comes to following limits on social gatherings, wearing a mask, and physical distancing. But a rapid antigen test is certainly better than no test at all. And we should be using every sort of tool we have in our toolbox at this point in the pandemic to keep Canadians safe.
Just in that vein, Dr. Naylor, are there some kind of real life examples where you could think these tests could be of particular use?
I think they can be used in a variety of congregate settings, in work sites, in schools, anywhere where there are people gathering. There's almost certainly a strong use case for long-term care. The challenge here, Vashi, is that you have to conceive of them, as Dr. Dalla said, as a screening test. You get a positive, you want to confirm it with the gold standard test still. But the point is, we need the information. We can't be willfully ignorant when we have tools that can shed light on what's going on in these settings where people are thrown together and where the risk of transmission is quite high. And so you want to screen, you want to pick things up. So many use cases exist, and the panel that Dr. Dalla is co-chairing is working to try to delineate more and more of them in the weeks ahead.
Dr. Dalla, I wanted to get your thoughts as well. I'll just go over for our viewers some of the responses we got. We're looking at provinces like Alberta, Quebec, and Newfoundland and Labrador, which are using under 1% so far of the tests that they have been sent. Provinces like Manitoba, only 1.5, about 1.5%. Nova Scotia at 5.5%. And you go up, the top two provinces that we received data from were Ontario at 18.47% and BC at 17.6. I mean, no province is even using a full fifth of the tests that they have so far. Does that surprise you?
I think what's happened is, so first of all, I think the provinces were right several months ago to ask for these tests. But I think to some degree what's happened is when these tests have arrived, the provinces and local public health units are also faced with implementing vaccination programs. And to some extent, there are only so many people around, so many resources around to do multiple things at the same time. And, it definitely does take some resources to implement a rapid testing program in a school or in a workplace. But we are a wealthy country with a very creative and resourceful population, and I think we can figure out how to do this. For me, the question comes down to, if I were working in a food processing plant, would I want to be screened? Would I want my colleagues to be screened once a week or twice a week? And the answer is pretty obvious. Of course I would. So, I agree with Dr. Naylor. Let's get these tests into places where people have to congregate, like essential workplaces, or where we really, really want people to congregate, high schools and elementary schools.
And just on the effectiveness or the reliability of them, I know you touched on that, Dr. Naylor, but some of the provinces, and there'll be an online article with more detail on the responses, but some of them had some questions about the reliability of some of the tests, and I know there's a variety of them now which have been procured. What is your sense on their reliability? And I take the point that obviously these aren't being used in the same way as the PCR ones. They're meant as screening tools, which I think is a salient point. But just as far as the reliability goes, because that was the big question initially. In fact, that's what the feds kind of used as a defense initially when there was pressure on them to procure more.
Thanks, Ashley. I think the question here comes down to false positives and false negatives. We know the false positives are pretty rare, which is important, and there will be some of them, but it's unlikely. After all, the issue here is being that these tests aren't as sensitive at picking up a virus. So given that is the likely direction of error, that it's false negatives, then what Dr. Dalla said earlier is crucial in thinking about how you use these. You're going to repeat the test a couple of times in a week. That helps deal with the false negative problem. As well, no one should get a pass to misbehave. If you get a negative result, you're not going to run around ignoring all the rules. So that question of wisdom in use is also there. But I think with those constraints in place, with that understanding, these are a competitive tool that used wisely can really help us to navigate this, what I hope will be the final phase of the epidemic.
And just very quickly, I have a few seconds left, Dr. Dalla, but is there another jurisdiction we can look to which has employed the use of these in an effective way and in a more pronounced way?
It's a great question. I think one of the jurisdictions that I look to actually is the United States. They haven't done an amazing job overall, but there are some pockets, like some of the professional sports leagues. The National Football League, for example, just had a Super Bowl. There's one team, the Seattle Seahawks, that didn't have a single case of COVID-19 the entire season. So, even within an environment where COVID is being transmitted quite widely, there are pockets, some colleges, some universities, some sports teams where they are using rapid antigen tests very, very effectively.
Okay, very good information. Thank you, both of you, for making the time and sharing your expertise tonight. Really appreciate it.
Pleasure, Vashi. Good night.
That's Dr. David Naylor and Dr. Irfan Dalla. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.